Hello friends, welcome back to my channel Complete Medical Coding. If you are new to this channel, please like and support my video. Please subscribe my channel. Today we will learn about anesthesia. Under anesthesia, there are four important things to notice when you are reporting an anesthesia code. First is an anatomical site, second one time, third age, and fourth modifier. Anatomical site is the place of giving anesthesia, which place that the doctor is giving anesthesia. Anesthesia time, that is more important. Anesthesia time begins when the anesthesiologist begins to prepare the patient for anesthesia in the operating room and ends when the patient is under recovery. Post-operative supervision means the patient is gone for recovery. So that duration is calculated as the anesthesia time. The initial time when the patient is being prepared for giving anesthesia till the recovery. Patient is sent for recovery. Then age. Critical age below 1 year and above age 70. We will report the code as an add-on code, that is plus 99100. That will be an add-on code along with anesthesia code. Now, anesthesia modifiers. Services involving administration of anesthesia are reported. So that is the range 001, 002, 01999 plus the anesthesia modifiers. Anesthesia modifiers are listed in the HCPCS book, whereas the other modifiers are listed in the CPT code book. You can find it in Appendix A of CPT code book. We'll learn more about in the detail. These are the modifiers, physical status modifiers, anesthesia modifiers. Okay. So these modifiers are represented by an initial letter P followed by a single digit from 1 to 6. These are physical status modifiers, P1 to P6, where P1 represents a normal healthy patient, P2 represents a patient with a mild systemic disease, P3 represents patient with severe systemic disease, P4 represents patient with severe systemic disease which is a constant threat to life. P5 represents a moribund patient which will not survive without an operation. That patient will not survive without any operation. That kind of patient is called as a moribund patient. Then P6, brain dead patient whose organs are removed for donor purposes. We can just go through an example. 001, 002, dash P1. This represents, if you can check the CPT code book, 00100, which represents anesthesia for procedures on salivary glands. Dash P1 represents it's for a normal healthy patient. So the question will be like this: anesthesia, code for anesthesia for a procedure on salivary glands for a normal healthy patient. If they are particularly mentioning it as a healthy patient or a patient with mild systemic disease or a patient with severe systemic disease, then we need to use that physical status modifiers along with anesthesia code. Then 01999, as usual, it represents an unlisted procedure, anesthesia procedure. Now moving on to qualifying circumstances. These are also the codes that are used as add-on codes along with the anesthesia codes. So anesthesia services which are provided under difficult circumstances depending on factors, that is extraordinary condition of patient, notable operative conditions, unusual risk factors. If there are some additional, like some difficult circumstances where anesthesia is going, then they are called as qualifying circumstances. These services will not be reported alone but listed separately as an addition to the primary procedure. So it means these are the add-on codes. 99100, it's an add-on code that is giving for anesthesia for patient either younger than 1 year or older than 70 years of age. Similarly, 99116, anesthesia complicated by utilization of total body hypothermia. 99135, anesthesia complicated by utilization of controlled hypotension. Similarly, 99140, anesthesia complicated by emergency conditions. If any of these things are reported in the procedure, then we will mark these add-on codes as well. Now let's move on to some practice questions. These are practice questions that comes under anesthesia. Okay. First is a simple question. Code for anesthesia for total repair of cleft palate. Patient 4 years of age. So patient 4 years of age, it represents it is above 1 year. So we don't have to report any physical status modifier. Because, sorry, not physical status, qualifying circumstances. I mean, there is no add-on code. So how to check code for anesthesia for total repair of cleft palate? You need to go to the index page, go to anesthesia, and if you can check under anesthesia cleft palate, you will get this code 00172. It's simple. Now code for anesthesia for screening colonoscopy. Screening colonoscopy, that's also same simple question. You can go under, you can check it under index page colonoscopy. Third question, code for anesthesia for C-section following failed attempt at vaginal delivery under spinal anesthesia. So in this, if you check the index page for the C-section delivery, you will get the code 01967. So 01967 represents a neuraxial labor anesthesia for planned vaginal delivery, because it is already mentioned in the question, it was a planned vaginal delivery, but that vaginal delivery has failed. So the anesthesia has given for the C-section, followed by the C-section anesthesia. So that failed, that code should be mentioned. Neuraxial labor for planned vaginal delivery. And then an add-on code, additional code is indicated 01968 to represent anesthesia for cesarean delivery following neuraxial labor anesthesia, because the planned vaginal delivery was failed. That represents the first code, and then the C-section anesthesia, that represents the second code. Now next question, code for anesthesia for ventral hernia repair lower abdomen, 76-year-old female. So for ventral hernia repair, we will use the code 00832, and 99100 is an add-on code for the 76-year-old, because above 70 years old we will use the code 99100. Moving on to the next question. Code for anesthesia services for closed treatment of fracture of humerus. Patient is 85 years old but healthy. So here we have 85 years old. Add-on code is there 99100, but healthy. So healthy means it's a normal patient. So we will use the physical status modifier P1 also. So closed treatment of fracture of humerus. First we need to check the code. It will be 01730. Then we need to put the physical status modifier -P1, and we will code the qualifying circumstances 99100. That is an add-on code. Don't use a modifier along with the add-on code. So that's why P1 is a modifier that will be used along with the primary procedure. So this will be the final code. Next one, code for anesthesia for colon snare polypectomy. That's also a simple question. You can just go to the polypectomy. You will get this code. Seventh question. Code for anesthesia services for extracapsular cataract extraction with insertion of intraocular lens prosthesis. Patient is 79 years old with a mild DM and hypertension. So in that, first you need to check the code for insertion of intraocular lens prosthesis. So in that you will get the code as 00142, which will be the procedures on eyes. Anesthesia for procedures on eye, lens surgery. This is a surgery. because cataract extraction is there with insertion of intraocular lens is there. So it will come under eye procedure lens surgery. So we will code it as 00142. Patient is 79 years old. So it means you will use add-on code 99100 above 70 years age with mild diabetes and hypertension. So it means the patient is having mild systemic disease. So we will use the physical status modifier P2 along with the primary procedure. That's how we will code this. Next question. Code for anesthesia services for CABG surgery of 5 vessels with pump oxygenator. Patient has severe coronary artery disease as well as hypertensive ESRD requiring hemodialysis. So in this, when you will go to the code for CABG surgery, you will get 00566 and 00567. But 00566 represents anesthesia for coronary artery bypass grafting without pump oxygenator. But our question is with pump oxygenator. So if you will go to the below code, you will get this code 00567. So each and every word in the question is important. You need to be careful. So code for service for CABG surgery with pump oxygenator 00567 is the code. And patient is having severe coronary artery disease as well as hypertensive ESRD requiring hemodialysis. So it means patient is with a severe systemic disease which is a constant threat to life. That is why patient is having requiring hemodialysis. So we will use the physical status modifier P4. Now next question. Code for anesthesia services performed on heart with pump oxygenator with hypothermic circulatory arrest. So first we will check with the code for anesthesia services performed on heart with pump oxygenator. That will be 00563. And then with hypothermic circulatory arrest. Hypothermic circulatory arrest represents severe systemic disease, same like the previous question. So it will be P4. And then because it's related to heart, hypothermic circulatory arrest, it is related to heart. So it will be a constant threat to life. So we will use the modifier P4. And then the physical status modifier, the qualifying circumstances also we will be using because it has mentioned with hypothermic circulatory arrest. So hypothermia, we will represent the code 99116. Anesthesia complicated by utilization of total body hypothermia. That add-on code also we will be using. Now next question. Code for anesthesia for Whipple procedure. I have just marked a hint like that. Whipple procedure means pancreatectomy, partial or total. Because if you will go to the index page and check Whipple procedure, it will show some other name. So when you will come to check the code 00794. So you will understand that if you will check the code 00794, it will show pancreatectomy, partial or total. And in bracket, it's mentioned Whipple procedure. But our question will be just code for anesthesia for Whipple procedure. Nothing else is mentioned in that question. So we will use only the Whipple procedure code, pancreatectomy code 00794. So these are just simple examples for anesthesia. Moving on to the next episodes, next following chapters, you will be learning more about other systems, other internal organs and the systems, and how to use modifiers, how to use E&M codes, everything you will be getting from the upcoming lessons. So that's all about anesthesia. Just a basic things I am taking initially from all the chapters and the basic practice questions. Then we will be combining it together and we'll give you practice questions for the exam practice questions. And then later we'll be discussing about the interview questions. So friends, that's all for anesthesia chapter. If you like the video, please like and support me, and please subscribe my channel. Thank you so much. Bye.